Welcome to all of you. And again, hopefully you'll get the sense this is intended to be an uplifting and positive talk. It's going to start talking about some obstacles. Don't get discouraged. We have tools to get you through those. Basically, what we're going to do is talk about the obstacles first and talk about what it looks like when we talk about long-term survivorship. This is a rest of your life process. And then give you some strategies to talk about improving your overall health and happiness so you can empower yourself to move forward in a positive way. And at the very end, again, as I said, there's some slides that will give you some personal worksheets so you can create your own map forward.
So to start out with, and as you all have probably experienced, each person's journey is really unique to each individual. So the biggest recommendation that we can really make is to find your own path through it. You can read a lot of information about this is what thyroid cancer looks like, and each one of you will have a caveat to that experience. So to really develop a plan for survivorship and treatment that really reflects you, your goals, your unique situation. We really encourage integrative approach to care. Now, never, to be replaced by Western medicine, but in complement to it. So we really do encourage you to give a holistic approach to your care. And medical therapy and psychotherapy, of course, when needed.
So can I take the mic off?
Yes. Yeah.
I'm a walker and a talker. So
do it.
Let's see if we can get it off. I went online because as we started putting together a survivor program at the Rose Center, one of the things we first wanted to define, well, what does it mean to be a survivor? We looked through a lot of definitions, and actually my favorite came from Webster's. Oh, okay, sure. Connecting. And I'll skip forward. When do you feel like your survivorship started? When did this change your life? Did it change after your first round of treatment or right at the time of diagnosis? Diagnosis. That's what we like too. The journey starts when you first hear that C word or when you say, oh, there's a nodule or you need to go for a biopsy. So it doesn't start after the first round of treatment, at least in our opinion, and that's the way that this country's going now. We'll get to talking about 10 years ago we wouldn't have this talk because it wasn't until 10 years ago that the Institute of Medicine even recognized survivorship as a phase of care. And 10 years ago they came out with a book recommending that this country recognize and start treating people through the survivorship phase. At that point in time, they recognized that survivorship as starting at the end of treatment after you had stopped treatment and were in the watch and wait phase. We've totally redone that definition. So I'll just keep reading because while Tim's working on this. But my favorite definition of survivorship is actually the secondary definition by Webster's. And I'll read it for you. A person regarded as resilient or courageous enough to be able to overcome hardship or misfortune. And I hope as you look at yourselves today, that's the definition you take with you. This isn't a crisis that happened outside of you. This is about the character of the person you are and working through it. There is only one organization who has even attempted to define the survivorship, and that's the American Society of Clinical Oncologists. And again, I don't like their first definition of that, which is talking about having no disease after completion of treatment, because we all know your treatment lasts forever. You're on thyroid hormone forever. You're on monitoring forever. Their secondary diagnosis discusses the process of living with, through, and beyond cancer. And that includes people on continuing treatment or that are either reducing or the risk of recurrence or management of chronic disease. And that should be everybody in this room that we're talking to. I'm going to hand it to Jessica and let her get going.
Okay,
so I have a video. Go ahead.
Is it time for me? Okay. So you all know that there are a lot of different types of obstacles that you're going to face once you've been diagnosed with cancer or any type of cancer. Thyroid is no exception to that. Some of the examples of this include complications with treatment. We've heard a lot of discussion on the financial burden that cancer presents in your lives, this fear of recurrence. And I think specifically for thyroid cancer, this is a lifelong kind of watch and wait process. It's really stressful. So reconciling that anxiety and learning to cope with that this is a part of your life forever. This is, these are big obstacles. Returning to normal, self-image, some survivor guilt. And there are talks, all this weekend about that really specialize in kind of each of these areas. There, you could do a day or a weekend really on any of those obstacles, couldn't you? This isn't a comprehensive list per se, but the message at the end of the day is really that moving forward, your life is changing, and there's no really looking back to kind of before. Each of these obstacles, kind of as they come up, you just kind of keep trudging through them, and we're going to provide you with some tools. And of course, I'm sure you've come across your own tools as you've gone along as well.
But this is a life changer. It's never going to be the same. You can't turn back. And it doesn't have to be a bad thing. That can be a positive thing. You can look at your life in a new positive way. But let me see if our video will play, because I'm very excited about this video.
There's a couple of stars from this video in the room. Want to move on to this one?
And the nice thing is you have there's so many people around you that are going through this. You don't need to feel isolated. And I think that's one of the most wonderful things about being here, is that you get to see that and hear that other people are going through the same thing. Oh, please. You did too? Wow. Well, I was hoping it would play. I'm not seeing. Let's try. Which one? No. Well, we'll come back to it at the end. I don't want you to miss the slides. If we can at the end, we'll come back and we'll try to play it at the end. Let's just go away. There we go. And we'll go back to this one. Almost all of you had surgery by this point, and surgery permanently changes you. You're going to have scar tissue. There's going to be some tightness. There may be some change in the nerve injuries. There's usually a visible scar. A lot of people have voice change. How many people in the room had a voice change afterwards? A lot. And sometimes it's subtle, and you go on the internet and you read only 1% of people have a nerve injury. That may be true, but that doesn't mean your voice may not change. There is going to be scar tissue around the nerve, scar tissue around the muscles, and some inflammation and things that happen. And so a lot of people do experience voice changes. And I've found for some people, particularly singers, that can be really devastating. Their pitch changes, their range changes. And if you love to sing and that's one of the things that made you happy, learning to deal with that can be hard. But again, that doesn't mean it's something that can't be overcome. So if you're having voice changes, you need to talk to your doctor so they can figure out why and what your options are, because some of those we can fix. The other thing that I'm hearing a lot of, unfortunately, this is not moving fast, is about people having permanent hypoparathyroidism and low calcium. The short term of that's pretty miserable. The long term generally settles down and people feel better. And can get on a regimen that's not completely taking over your life. And again, it can be managed long term, and if you don't feel like you're getting there, talk to your doctor or ask for a second opinion. It's okay, but also recognize that some of these changes to your body take time for your body to figure them out. Radioactive iodine, also the same. How many people in the room did their radioactive iodine? Terrible or not too bad? Probably depends on whether or not they took you off your thyroid hormone for that, right? Coming off the thyroid hormone for that pretty miserable, and some of you are probably still having scans, you know, in the future that maybe you have to come off again. There are other options for that. Talk about thyrogen with your doctor. It may or may not be appropriate, but that can make it easier. But just the financial burden of that, the you know, salivary changes that come with that, and I've had some people can't eat spicy food anymore. There are people out there that specialize in the salivary glands that can help open ducts that are clogged and help make it better and help train your body and open things up and make it a little bit easier. Dry eyes, how many people have dry eyes? Plus it's Colorado here. If you live in here, you already have dry eyes. Take care of your eyes. Just remember, a lot of people need drops. If you don't take care of your eyes, you let them get dry, you can get corneal abrasions. Long term, that's bad for your eyes and can impair your vision. Did anybody tell you while you were at risk for cavities? Anybody mention it? Did they tell you that when you had radioactive iodine? The effects on the salivary glands have long-term impacts for your dental health. Generally, we recommend that patients with thyroid cancer are being seen twice as often as regular patients because the saliva is what bathes your teeth and helps keep them healthy. So you want to talk to your dentist. Make sure they're screening you, cleaning your teeth appropriately, and they may want to put you on different rinses or gum chewing regimens or other things to help reduce your risk of cavities or treat them earlier. Lastly, did we tell you you're at risk for other tumors? Number one, if you've had thyroid cancer. Yeah, breast cancer is one of those in particular. With medullary cancer, a lot of patients with medullary cancer, they have tumor syndromes that have to be worked out. But number two, the radioactive iodine does slightly increase your risk of other cancers, including breast cancer, lymph node cancers, and bloodborne cancers. So, you know, keep being screened, be diligent about your health, and if you keep up with your health care, we can catch problems and treat them early. If you don't know what problems you're looking for and you haven't alerted someone else to those things, it's really hard to catch them and treat them early. The other thing I would say to that is, sadly enough, most of you are not going to have a highly educated provider as your primary point of contact. There's just not enough thyroid cancer specialists out there in the world or good endocrinologists that you might connect with. You're going to have to be your own advocate. So some of it is knowing how to direct your care, helping guide and educate the people that are helping take care of you. And don't feel bad about that. Don't feel angry about that. That's just the reality, that we have to help doctors do a better job. And particularly primary care doctors, they are overwhelmed. They're overwhelmed with so many different things. So if you can be your own advocate, be educated about your own disease process and what you need and what your map looks like, you can help them get you to the right place. You want to talk about that one?
I think we should do more on this.
What's that? Oh yeah, you can do that.
A show of hands, how many of you in the room had difficulty transitioning to the synthetic thyroid hormone? So that
less than I would have expected.
Actually, yeah. We see about a third of patients have difficult time transitioning to that. A little bit about the way that hormone works is that organically in the body, the hormone responds in periods of stress. When you're on the synthetic hormone, it's just a stable level of hormone in your body, so it doesn't know to respond in those periods. And that can be an adjustment in terms of lethargy, energy, weight gain, changes in your hair texture, changes in your skin, dryness. I mean, these are kinds of all the things we see. And because of the way the synthetic hormone works, we can't replace it week to week to get that level right. So the process of getting a level that works for you is a process, and it's time consuming. The other thing is you're being heavily supplemented, right? Because we're really trying to suppress all thyroid hormone that's left. And a consequence of that is changes in your bone health. Something that we know with this oversupplementation is that you're at a greater risk for osteoporosis. It also causes a little bit more strain on the heart, so you need to really actively look at your cardiac health. And of course, weight management. It's really, you know, the way thyroid hormone works is really helps with your metabolism. So you may have changes in your weight, and stabilizing your weight, keeping it a healthy weight, can be more challenging on the synthetic hormone.
All right, how many of you felt the financial impact when you got this diagnosis? Should be almost everybody, but thyroid cancer in particular seems to have a bigger financial impact on people than some of the other cancers. And in terms of risk of bankruptcy, we see risk of bankruptcy in thyroid cancer patients is over 3.5 times the baseline of the population. And that's more than just patients with any cancer if we take up breast cancer, colon cancer, and other cancers. So this is a big long-term thing that you have to look at. On top of that, you got to be smart about your insurance, because that's where you can really get hurt in terms of financial burden. Now, how many of you were told this could come back? Good. Almost everybody should raise their hand, because it can, unfortunately, and about 20% of you will experience a recurrence. The problem is that may not be right away. That could even be 20, 30, 40 years down the road. I saw somebody recently, 60 years later, she's having her recurrence. Monitoring is lifelong. So you can't fall off the bandwagon with your thyroid hormones. You can't fall off the bandwagon with your monitoring. This can grow slowly, and it does need to be continuously treated. It's important for you to know what your particular plan is. And again, as we talk about making your map, you want to know what your plan is for monitoring, how often, what needs to be monitored, and who's going to draw that hormone, who's going to read it and give you the answer, and you should ask for that result. The other thing we like to talk about is something we call biochemical recurrence, and this is the one, as I was in the lymph node meeting earlier, I could feel the anxiety of knowing that there's cancer in there, but there's nothing you can do about it.
Yeah, no, somebody actually posed a question in the lymph node discussion about so oftentimes you're gonna have testing and lab values that reflect that there is cancer still left, that those cells are still present, but they're such microscopic levels that there isn't really an intervention that can be done. So
or it's a lymph node, and the lymph node is too small to biopsy, too small for a surgeon to find and take out, or the risks of a surgeon going in and taking it out are worse than letting it sit for a while.
Right. In general, this cancer is very slow growing, and there is a real watch and wait philosophy. And that, I think that's very, very difficult to reconcile, that you know that there's cancer, you know it's in your body, and there isn't necessarily anything that can be done. So we're, again, going to suggest some tools to sort of navigating through some of that anxiety, but that's a, you know, again, this is a lifelong change that will potentially always be there, that fear and that anxiety.
So the first part of your map, the question I'm going to pose to you, do you know what your medications are? Do you know which brand name you're on? Because most of you should be on brand name medications. Maybe it's more than one medication. Know your medications, know your brands, know your doses. What's your goal for your TSH and your thyroid hormone levels? Know what that is, write it down, and then track your thyroid hormones and compare and understand what range is acceptable and what range is not. What tumor markers are we following? And you want to know what's the range and what point do we get concerned, because a lot of you will come positive with a tumor marker and will choose to sit on it for a while. So you need to know what the point of intervention is. Write these things down. For the medullary cancer, we're watching different tumor markers, in particular calcitonin. So again, you want to know, what is my baseline, where am I starting, and what am I looking for? Keep records of those labs. Also keep a record of what the next step is, what the next step in your plan is, your testing pattern, and whether or not it's appropriate for imaging. Imaging is not appropriate for everybody at every step, but there should be a plan forward on what the next step will be. Even if that step is, we look great today. Okay, well, when are we rechecking it? All right. This is the thing that I'm feeling as I go sit in the rooms. This is the hardest part, is returning to normal. You don't return, you go to a new normal. And finding what that new normal is for you and redefining yourself as a person is a process. It doesn't happen overnight. We're going to talk about tools that we have. I'm finding a lot of stuff that I'm hearing about changes in relationships, fear, anger, and the impact that those are having, not just on you, but on the people around you. Unfortunately, this really impacts not just you, but the people around you, can impact your relationships. I've unfortunately seen folks get divorced after a cancer diagnosis because coping strategies were different, or people's values changed, and your values might change. Those changes, again, don't have to be negative changes. They can be positive changes. And a lot of people work through those changes and build on their relationships to create more positive, stronger relationships. But you have to be able to recognize what's changed. And it, again, takes some time and some reevaluation of yourself.
You know, just one thing that actually is in the video, if we ever get to it, is there's a patient who's in the video who says, you know, you think you get a diagnosis of thyroid cancer, and most likely it's treatable with perhaps just a surgery, perhaps a one-time medicine treatment or radiation treatment, and then done. And that's just not the case, right? It really is life-changing. And so I think the perception around thyroid cancer, we have all of these people who are living with it and learning to, you know, change their lives and move their lives forward with this diagnosis. You know, I think to kind of recognize that shift in that perception is really important.
And then lastly, again, this idea of dealing with uncertainty and, you know, the anxiety of even going to appointments, waiting to get those next set of labs, and this, oh, well, we're just going to watch and wait, and trying to move forward and not dwell on that. It's horrible. It eats at you. When I was in training, I went through a really rough episode, and one of my mentors set me down and said, well, Kim, we know there's two things that make people unhappy. Lack of control and lack of predictability. If we can give you one or the other, or the perception of one or the other, you'll be fine and you'll be able to cope and get through it. But if we take both of them away from you, it's pure chaos, and people get severely, severely unhappy and depressed. What we're going to try and give you moving forward is at least some perception that you have some control, and that by knowing what that map is and knowing what's coming and knowing what the steps are, you at least have some predictability. The thing that I have found the hardest for cancer patients is after a phase of treatment, when we hit watch and wait, that's when people get really anxious and depressed, because up until then you had so much to do, you didn't have time to think about it. When the treatment stops, you say, we'll see you in 3 to 6 months. Suddenly it hits. And it hits hard, and your brain circles around it, and you start having all those thoughts that most people would have thought, you know, oh, well, didn't you go through that at the beginning when you first heard the C word? Maybe for the first weekend, until you started all the things that you had to line up. But you were so busy that you didn't have time to actually deal with those feelings of anxiety moving forward and the change that actually happened. So, again, think about that. We're going to at least try and give you some control and some sense of predictability, but we all know we have no control and no predictability in the world.
Okay, so biggest thing is to educate yourself. I mean, I have to tell you all, I've actually been very impressed in just the talks that I've been to, the wealth of knowledge that you all have, and just even being here, you know, to learn about the disease process and all the different aspects of treatment and survivorship. That's going to be your biggest weapon and tool moving forward, is that education. It's going to really arm you with the information that you need to make decisions moving forward about your health care. Be your own advocate. What can I tell you? So I work as a nurse navigator, and the biggest challenge that people come across seems to be that they just don't, it's such an overwhelming system. It's so complicated. There are so many pieces. There are so many providers, and moving through that is very daunting and overwhelming. And unfortunately, fortunately, the situation that we're in is that you have no choice really but to be your own advocate as you move through care. You're going to have to assert the things that are important to you in terms of treatment, in terms of surveillance, and really be prepared. The other biggest piece of advice that I think I give patients that I work with who are moving, especially transitioning from the treatment piece into the survivorship piece, is to create a relationship, a really good, strong, long-term relationship with your provider. And we live in a culture where that hardly happens anymore. You shift insurance, your provider shift. You relocate, your provider shift. Providers retire, they change practices. And so practically, this is really challenging.
How many of you have changed providers since your initial diagnosis? It should be a lot. How many have changed insurance? How many have paid cash out of pocket to keep a provider that was good? Think about it. Think about it.
Right. So I'm not saying this is an easy task. But I'm saying that it's an important one, especially because this is a lifelong surveillance process. And that recurrence, long-term recurrence, 10, 20, 60, is that what you say? Years out, that's something to really think about. And again, you know, that's part of advocating for your own care, is creating a relationship with a provider where you feel the provider's goals and approach to care are in alignment with your own. And I am not suggesting that's an easy task, just an important one. So as you do research and as you educate yourself, you're going to be exposed to all kinds of recommendations from all different kind of expert guidelines that tell you about what the recommendations and the suggestions are for treatment.
And that includes your ex-girlfriend's boyfriend's brother that's going to tell you what you need to be doing for your cancer care or how somebody should be following you.
Follow those, discuss those with your provider. These are what the recommendations say. Now, you know, it's kind of a little bit about what we were saying in the beginning of this talk, is that it's going to be individualized to you. Perhaps your cancer and your situation doesn't need the kind of close surveillance with scanning that somebody else's care might warrant. So discussing those recommendations and reconciling them and customizing them to your own goals and your own path. Ask questions. So something that I do with patients, and I do really recommend, there are navigators in probably every market, and that's really growing in terms of the model for healthcare and the way that diseases are moving through healthcare. Find a navigator. One of the biggest things that I'll do with patients is go in on initial consultation with the provider that's going to look after their thyroid hormone and their blood levels moving forward after treatment when they're in surveillance. And something that I'll do is go in and meet with the patient prior, and we'll prepare a set of questions. So what is important to you? Is close surveillance important to you? Is a conservative approach more important to you? Really identifying your goals for treatment and for survivorship, and then going in with those questions and having something to write the answers down on. Staying organized. I mean, I can't really promote that enough. And then as test results come in, I think it can be really confusing too. Discuss those results. What does it mean? As Dr. Vanderveen was saying, you know, what's the point where we are going to really think about next steps and intervention? And again, keeping records of those answers. Again, as we change healthcare providers and we change systems and insurance, I really recommend that you keep a record of your levels. There's no one that's really going to be able to attain whether there have been shifts in your levels better than you if you have those records. So really keeping kind of a very organized binder where you have your laboratory section and your scanning and imaging section. I really recommend that. And there are some tools on the internet to sort of help support you with that.
And when a level shifts, make sure you discuss with your provider what that means, because there can be a lot of reasons that a level shifts. Recently here in Denver, we had the Quest laboratory system changed assays for thyroglobulin, and I had about a third of my undetectable people go to detectable. And there was a whole bunch of phone calls going off, and people were freaking out because they thought their cancer was back, but all it really was a shift in the result and the lab value. And so I've had some other patients that, you know, they switched drugs, or they didn't realize their pharmacist switched their brand name to a different generic, or brand name to a different brand name, and when their levels got off, their thyroglobulin did some funky things. And that happens, and knowing again, what are the points where I get nervous versus what are the points that are okay to wait and see and recheck, again, very important.
So, you know, as we were suggesting kind of before, a real integrative approach to wellness. So we know that exercise is good for overall wellness, and we also know that we lead busy lives, and this is not easy. We all struggle with making time for exercise, and
I skipped my workout today for this.
We know it improves your overall health, right? We know it's great for anti-inflammatory, so it helps in your immune function. We know that it affects the happiness centers in your brain. We know it reduces pain. So if at all possible, to really carve out and schedule time for exercise in your life.
Even if you can get 20 minutes, you say, okay, at lunch, I'm going to walk 20 minutes down this corner to get my lunch and come back. If you can just find some small ways to get it in, it is really important.
Alongside that, is nutrition. And I think there are a few talks at this weekend about exercise and nutrition specifically for thyroid cancer. I think also we know weight management. We know that maintaining a healthy BMI it really does reduce the cancer reoccurrence rate. We know it also has great benefits to your cardiovascular health, and we know that it prevents other types of cancer as well. So alcohol in moderation, everything in moderation. And overall health maintenance. So your immunization, staying current on those, protecting yourself with that, routine cancer screening, so mammography and colonoscopy, smoking cessation. If you are using tobacco, that's probably the most positive way that you can impact your life is by starting to think about quitting or quitting. Marijuana, well, we're in Colorado, so we have to touch on that. There's a lot of conflicting evidence about marijuana.
And I don't know if it's conflicting evidence either. It's conflicting things that you read. I don't see a whole lot negative when you try and Google or read about marijuana. But there's been no proven benefit in terms of longevity, cancer prevention, or any of the other things. It's not going to make your life magically better. If you want to smoke marijuana, we say again, like alcohol, using those substances in moderation is very important. Letting your provider know that you're using them, important. And I also like to talk to people about the fact that if you're smoking marijuana, that smoke is actually more caustic to the lungs than cigarette smoke. Causes earlier lung cancers. So keeping that in mind, if you are going to routinely use marijuana, and there are a lot of people that have routine daily marijuana use that are now just finally admitting it because it's legal, there are some serious health consequences to that. And you need to let your provider know, and ideally if you can get away from routine daily use, it has some serious impacts on the intestinal system, your nervous system, and your cardiovascular system. And that's all I'll say on it because, again, that's not the point of this talk. But keep that in mind. That is not necessarily a positive for your health. It's something that we allow in moderation, just like alcohol. Again, probably better to stay away, but if you have to, in moderation. And then, of course, just smart sun exposure. And this is where I get excited because this is the best part of the talk, is talking about your psychological support and what we call positivity training. Who's heard the word neuroplasticity? A few people, yeah? The brain is a living organ and it grows and changes. And we've learned over the last about 15 years that you can change your brain. You can strengthen certain neural networks, and you can weaken other ones, and you can have a positive change. Some people subscribe to maybe lumosity for mental thinking to reduce your risk of mental decline forward. We also need to exercise our brain for positivity and happiness, and it works. So we're going to talk about training exercises that you can work on to be a happier person. This will help you with your coping skills, interactions with other people, and then just for you as well. We also know this is good for your physical health. Happy people have a lower risk of cancers. They have a lower risk of recurrence once they've had a cancer. They have a longer survival and are more likely to complete their treatment regimens, and they report less pain than people who are unhappy. And again, this is trainable. My son is learning about happiness training at school, and that's not what they call it. They call it the bucket, and they talk about putting water in the bucket or dipping water out of the bucket. In Rochester, Minnesota, they have instituted a happiness program at the Mayo Clinic, at the medical center down the street, in all 3 school systems, and they're using these principles to teach children to train their brain for a positive lifestyle. The basis of understanding your brain and how it works, I think we've heard people talk about, well, if you get one criticism, it takes somewhere from 3 to 8 positive things to overcome that one criticism. The brain is wired for threats and control of threats. So it will perceive and magnify threats in the surrounding. And now that we're not fighting, saber-toothed tigers, we create internal threats. That's part of what we're trying to talk about with the anxiety and fear of recurrence, that those threats are not staring you in the face. A lot of them are internal, and that they're not real right this second. They're potential future threats that we have to deal with. And again, we can create severe anxiety and depression by exercising those pathways that take us down that road. So we need to move to different pathways. You have to exercise the pathways or they get weak, just like if we don't exercise our muscles. So there's only 5 things, 5 behaviors you have to do to lead a joyful life. That's the easy part, 5 things. Those 5 things are not in and of themselves easy, but we will talk to you about what we can do along those lines. The most important of these is gratitude. And these are behaviors. They're not personality traits. You can perform gratitude behaviors that will train your brain to be positive. How do we do this? Acknowledge your blessings. Appreciate the good things in your life. Instead of comparing to what you don't have, what you wish was different, think about the things in your life that you are happy about. Think about the things that you are grateful for and focus your energy that direction. When we practice gratitude behaviors, we have reduced pain and health complaints. When we practice gratitude behaviors, we have improved happiness in ourselves and people around you. So let's do some exercises, shall we? It's easy enough to say thank you, and you probably didn't realize there's a lot of market research in the marketing and sales industry just with the word thank you. The word thank you written on a receipt at your bill at the hotel bar will increase the tip that you give to your server. Saying thank you will improve not only your happiness, but the happiness of people around you. You can make an exercise of trying to say thank you 10 times a day. This can also be things like writing thank you notes or thank you letters. So just the simple act of saying thank you is a positive way to train your brain. They have done studies with college students looking at gratitude journals. They've also repeated those studies in cancer patients. And they say if you keep a book and once a day you sit down and you write 5 things in the book that you are grateful for. At the end of the week, you'll already see the difference in your overall happiness. And that's an easy thing to do. Mm-hmm. And then you visually see those gratitudes and things build as you're building them in a brain. It's a really good visual way. I love that. Oh, so the comment was the idea of keeping a gratitude jar where you write gratitude on it. You can have one at home, one at work, or wherever you want to put them, and periodically writing things down you're grateful for, putting those pieces of paper in so you see that jar grow. If you're having a bad day, take some things out. It helps you keep perspective. Also performing daily gratitude meditations, and this is one I really, really try hard myself to do every day, and it's the one I'm most likely to forget until I get in my car and it's too late. But we'll do one. You want to do it? No, you got it. Oh, okay. So I want everybody to close their eyes for a moment. And I want you to take 5 deep breaths at your own pace. The first thing I want you to picture is the person who's the most important to you. The person you are most grateful for, who has made the biggest impact in your life and helps make you the person you are. I want you to imagine their face and the details of their face, and I want you to imagine their smile. Take a moment to really think hard about that person. Now send them a silent thank you. Secondly, I want you to think about a healthcare worker. A lot of you have had some bad healthcare experiences, but think of a healthcare worker that was really helpful to you, that made a big difference for you, made a change, did something positive. Doesn't have to be a big thing, but something really positive that has affected you and who you've become and how you're moving forward. Think of their face. Think of their smile. Smile at them, and now send them a silent thank you. I want you to now think of a third person, somebody that you've lost. Maybe somebody that just has fallen out of a relationship with you because of time, or maybe it's somebody who's passed on. Think of the positive way that they impacted your life. Think of how grateful you were that they did impact your life. Think of their smiling face. And again, send them a silent thank you. Lastly, think of your 10-year-old self. Remember what you were like at 10. Remember your whole life ahead of you and how happy you were. Think of your smiling face, how few responsibilities and obstacles you had. And be happy for that person who has become the person that sits here today. Send that person, yourself, a silent thank you. I recommend performing an exercise like this every morning before you get out of bed. First thing you do when you get up, before you put your feet on the floor, try and do this exercise with your five deep breaths. This is the one I have the hardest time with because I get up and I run out the door. If you can put a sticky note on your mirror, get back in bed and start your day over because this is the best way to start your day. Lastly, you can do these sorts of things at dinner prayers as well. With my children, we sit down and we go through each person's day at dinner, which gives us a great time to interact and ask them, what happened today in your life that you were really grateful for? Was there something special about your day-to-day that you'd like to share? Those are easy ways. There's lots of other ways to do this, but this is probably the most important one.
That's pretty powerful, that gratitude exercise. So the next piece is acceptance. You walk in the door from your day at work or your busy day, and you see your significant other, you see your kids, it's chaotic, and you go right in for, we need you to be doing homework, you need to be cleaning this, you need to be fixing this. And this next exercise is about walking into the door and greeting the people that you love with an attitude of non-improvement. So to pretend as though perhaps it's been a week or two since you've seen those people, you walk in the door and think of how you feel when you haven't seen somebody that you love for a couple of weeks or longer. The excitement that you feel, the kind of open attitude that you go into greeting that person. Trying to acknowledge them and acknowledge who they are and the flaws without necessarily trying to fix them, just sort of accepting who they are. I think appreciating those positive things really, it puts things into perspective. The other thing is on the acceptance module is that, the first thing we do in the morning is we go look in the mirror and try to modify everything so that it's acceptable for everybody else. And so instead of walking into the mirror and looking all these things we need to fix, to go over a couple of things that you really like about what you see. It's cheesy, but it's really, to go at that mirror with a positive attitude. It's life-changing. It's attitude-changing. The other thing on this is, will this matter? So you get into this conflict or you get into this situation where you walk in and you are feeling so uptight and wound up. To think about, in 5 years, am I going to remember that these dishes weren't done, or that this wasn't cleaned, or that, I don't know, any number of things, and kind of put some perspective on it.
All right, number 3, compassion. If you look at Buddhist literature, the two most important ones they pick are compassion is number 1 and gratitude is number 2. And compassion they define in patience and kindness towards others. We put it as number 3 not because it's less important, but because it makes it easy to just get it on a slide. But again, this is a practice. It is an exercise. It's a behavior. How do we practice patience and kindness? Smile. Smile. Make a point to smile. If that's something that's difficult for you, set a beeper on your phone, maybe one that makes you laugh. And every once in a while a day, get yourself a smile. Also try and send silent blessings to people that you may not be happy with. You may be upset with their behavior. And really think hard about, do you really wish them harm, or do you wish, A, maybe they just go away, but that they'll still be well? Wish them that silent blessing and let them and have peace with them. Along those lines, we do actually know with neuroscience research, again, random acts of kindness improve your own personal sense of happiness. So if you see a meter about to run out, think about throwing a coin in there. It will improve your own happiness. Little things, somebody drops something at the store, pick it up and give it back to them. That will improve your kindness. If somebody's trying to get in a very busy parking lot and get out of the parking lot, and you have the opportunity to stop and let them in front of you, you will actually be a happier person. Any volunteer work that you do, most people do that volunteer work because it creates a personal sense of purpose and joy, as well as being able to create that in others. So again, if you have that sort of opportunity or time as well. Lastly, not quite lastly, but fourthly, forgiveness. This I'm going to urge in a lot of you, because I felt a lot of anger, and some of that anger's been towards providers, some of that anger's been internal, some of that anger's been towards people in relationship with you that haven't reacted the way that you wanted them to. Forgiveness is a very important practice for you being able to move forward, and we're going to do an exercise for that. You may forgive without forgetting. You don't have to forget. Forgiving does not mean that it was okay that it happened. It does not alleviate the stress that it caused to you, but it allows you to acknowledge that it happened, and again, be able to distance yourself and put it away. We use the concepts of acceptance and compassion when we do that, and again, we're going to wish the person well and send them a silent blessing. So let's do this again. Let's close our eyes. And I want you to think about somebody that's hurt you. I want you to think about how much it hurt. And that could be a physical hurt, or more often it's a psychological hurt. Think about the long-lasting implications of that. It hurt for a while. Did that person hurt you because of incomplete knowledge? Did they just not have the right information or wrong information? Did that person hurt you because they were confused? Or was there a miscommunication that might have led to it? Or even a miscommunication on your part that might have led to that? Did the person act because they were feeling defensive? Were they under stress and didn't have their own coping skills to do the right thing? Now, as you think about that hurt, let's turn it around and think about the positive things that can come from that. Have there been positive things that have already come from that hurt? If not yet, can you use that hurt to create something positive? Can you be proactive to make that hurt positive? Can you send that person a silent blessing? And if that person is you, can you forgive yourself, or at least just a little bit today, and try again tomorrow, and try again the next day, and recognize that this is a process? Lastly, the final principle to finding happiness is finding meaning in your life. That can be a really global, deep spiritual thing. That can be just little bitty things that happen at work every day, or little bitty choices that you make that are important and meaningful to you. We recommend things like volunteering and interacting with other people, because we find interacting with other people creates meaning around you. Each person will have their own journey on this. I'm not going to give you an exercise on this. You have to find your own. So find your own and think about this, but this needs to be part of your happiness plan. The last thing I want to just kind of differentiate, because people will sometimes confuse this, is fun is not the same thing as happiness. Fun feels good while you're having it, but it may or may not make you feel good long term. Practices that improve happiness are things that will improve your long-term sense of well-being. So yes, you can have fun and you should have fun, but it's not a substitute for doing practices that create happiness.
Right, so creating the map.
So we're going to summarize it for you now, and we're going to put it all together.
Creating a plan for your follow-up. Understanding and participating in your health care. Right, we talked about that. Meds, results that you're going to track, how you're going to advocate for yourself moving forward. What's your plan for improving your general health, exercise and good nutrition, weight management? And then these strategies that we've kind of talked about in terms of pursuing happiness and these behaviors that we also need to practice. We've also included in the presentation a couple of tools to help empower you to do these things. One is kind of what a workbook would look like. So who is the provider that's your primary contact? Creating a summary or a binder that includes your medical history, your operations, your treatments, your pathology, your imaging, your lab work. What are your baseline goals? What are the changes you're going to bring to the attention of your provider and discuss? And then this is kind of like some structure around that. So to track the dates, the medications that you're on, what testing needs to be done, what the results are, the plan, the next steps are. And these are super helpful when you change providers. My folks that have 10 years back, well, this is what my thyroid's been doing, this is what my hormone's been doing. It's super helpful. We find this is one of the biggest transitioning. This one is summary page. Saves hours sorting through other things. And it doesn't have to be an Excel worksheet. That's my type of personality. But yours can be just those written reports where you tracked what the value was and you wrote it down. Or you can make a handwritten version. Your version is going to be right for you that helps you find the information when you need it. So creating some sort of system that helps you find your information when you need it. This is just how my happiness plan works. So I try really hard to remember to do my morning gratitude meditation. And that's the one I'm most likely to forget, and I remember right about the time I'm halfway down the street in the car. And then by the time you get to work, it's a little difficult. However, because I'm the boss, I get to have everybody at work do them too. And so at my office, we have a plan and a theme for the day that goes through the week. And so in the office, the first thing we do as we check in and sign in is Monday is Gratitude Monday. And we stop at the very beginning of the day and do a gratitude meditation. And it doesn't have to be the same every time, and you can vary it for what's important. And for work, we try and think about things about the workplace that we like, about the job that we're doing that we like, that we're grateful for. And we spend a lot of time Monday doing that. And we have a good joke around the office. It's Gratitude Monday. And we go through that process, but it really, really helps. And you can do this, again, in your own office. Create your little gratitude bin and keep those things with you. You can take your journal with you to work. You can put a sticky note up, one sticky note a day, about something you want to think about all day and be grateful for. Tuesday, we work on compassion. Wednesday, acceptance. Thursday, we work on higher purpose and meaning. And for Friday's Forgiveness Friday, it gives us a good opportunity to clear the air in the office if we've had conflicts or things through the week, and let everybody go home at the end of the weekend with a clear conscience and let things go until we can start over on Monday. Generally on the weekend, we recommend that you take that for your own type of celebration and prayer. And then I work really hard on smiling and saying thank you as many times a day as I can. There are a ton of references out there for you as survivors. I've listed a bunch, and again, if you want these slides, they'll be available for you. Slides about survivorship and the plans that are recommended, the ATA guidelines which are coming out, which are on the web. They are already published at nccn.org, the new thyroid cancer guidelines. And again, information about thyroid cancer and their diseases. We also have some great books listed here, including books by the Dalai Lama, books from the Mayo Clinic, books about hardwiring happiness that give you additional techniques that have neuroscientific proof for improving your happiness and health. So these things we now, in the last 15 years, actually have proof that they work. And so there's no reason not to do them, but you do have to exercise. And now we'll open it to questions or maybe a video if we can do it. So I'll let you go for questions, and I'll try and see if the video will come. I hope this was helpful for you all. Anybody have any questions or thoughts? Yeah.
Do most hospitals have like a nurse navigator? This is the first time I've ever heard of that.
So the question was, do most hospitals have nurse navigators? And there's a short answer and a long answer. It's a growing role, and not just for cancer, but for all disease processes. So what we're finding in the way that healthcare is changing and the way that the model is shifting, that patients are really getting lost in all these pieces. And what institutions have kind of gleaned over recent years is that it's helpful for patients to have somebody, a liaison throughout that process, to really help move patients through the system. Institutions' motivation for that is to retain the patients in that system. And
most comprehensive cancer centers will have one. It is a big part for a comprehensive cancer center. If you are not at a place that has a comprehensive cancer center, they may not have all the resources there. They may not have integrative health resources like acupuncture and chiropractic and yoga and all the other things that you need, nutrition support. That's the one advantage of comprehensive centers. And there's community comprehensive centers, and there are academic comprehensive centers. We're fortunate here in Denver to have several, but not everybody has one. And again, sometimes it's worth traveling for those resources, just like sometimes it's worth once a year paying an out of pocket for somebody who's a really good provider to keep them involved. And again, if you can afford to do that, it might be worth it to reduce the stress and other things. I've seen a lot of people in the last year that switched health insurances, and they were trying to keep their costs down, and in the process they went through 6 months of misery because they couldn't get the things they needed. Their new providers didn't understand the regimens. They got switched on medications, and now they've switched health insurance, tried to get back, and now it's going to take them another 6 months to a year to get it all fixed and back into the balance that they had created before. So again, just be careful with your health choices.
And speaking to that, I think as far as how navigation is developing, in oncology in general, there really are, it's becoming more and more common in more complex types of cancer. Thyroid cancer is not considered one of those. So that's rare to have someone that specializes on that. Some insurance systems really have modeled kind of the way navigation works, and it's very much developing. I would start with the internet. I would start with the institution, maybe if it's recent that you had surgery, or where you get your endocrinology care, and those people might be able to partner you with a navigator. And it's developing also in bariatric programming and cardiovascular programming, and we're finding that navigation is really very, very helpful. Any other questions?
Sorry, you're all getting my email.
Yes. When you were inquiring for what? So the question is, she's, okay.
So I'm just wondering, is that still the case? Because I have thyroid
Oh, most thyroid cancer is managed through endocrinology. Medical oncologists in general, not very well trained to deal with that. They're not well trained to deal with the thyroid hormone replacement regimens that we're talking about. I have some patients that do use a medical oncologist as their primary person, either because they have anaplastic cancer, medullary cancer, or they live in a remote region where there's not an endocrinologist. And then we have to have some sort of communication and help that medical oncologist. Endocrinologists are cancer specialists. They are thyroid cancer specialists, and they're very good at it. The problem we have is there's not enough of them. And so I do have a lot of people that are followed by their primary care doctor or nurse practitioner. And again, trying to educate that person to what you need. Not everybody needs a thyroid cancer specialist all the time. But again, if you know what your plan is and know what those cutoffs are and know when your primary person needs help, if you don't have, maybe a real educated or LinkedIn primary person.
Does that answer your question?
Yeah, just because she touched on that they have
Good access to those services.
If you could call and ask if they have a nurse navigator, that's the best LinkedIn. There's people in this room that got LinkedIn because of her. They were in the wrong place and got LinkedIn. So the nurse navigators are helpful. And what's nice is they know what services are available, how to get you to them, and what other things need to be coordinated. So if you can get a navigator, that's the best way to go. We will try really hard.
Give it one more go.
I'll give it one more go around.
Any other thoughts or questions, or please?
My name is Sue.
Hi, Sue.
I was diagnosed on December 13th, and she's my doctor. And she operated it a week after I was diagnosed. Her and her staff did a terrific job taking care of me. And she took so much time and answered every single question that I had. And she really helped.
And it's unfortunate that, we send a lot of people back that don't have as much time on the next go around, but you're very welcome. You're very welcome.
It's actually been just interesting to hear different people's experiences, just in the different talks and some of the challenges that other people are speaking out about, and kind of put some perspective in terms of just how good the care, how amazing the care is with Dr. Vanderveen and her staff, and really how good the outcomes in general and the treatment trajectory is with the patients that we work with. We feel really lucky.
If anybody would like to share some of their gratitudes or positive stories, again, you can. Yes, go to that mic. Go to the mic. Because you've had a few obstacles. You've had a rough road.
I'm a nurse. I was shaving and found a nice little lump. And even though I'm a nurse, I thought I better go see a doctor because we're kind of reluctant about that thing. And I went and saw my primary. And even, as a nurse, I have a lot of experience. I knew I'm going to have to do a little directing. And I worked in a clinic, and I constantly told patients, you hire them, you can fire them. If you don't like your doctor, get another one. The days of let's do everything they say is over, and that's no slam, of course. But my doctor sent me to a hem-onc doctor. I'm like, no, I need to go see a surgeon. He goes, no, this is who we refer to. And I was like, okay, I'll play the game, and walked in, and fortunately she walked in. And she goes, what are you doing here? And I'm like, thank you. She goes, I know this great surgeon across the street. Let's go. And went over there, talked to Dr. Vanderveen, boom, boom, boom. I had a vacation plan, and she's like, go for it. Because, if this is too late, then we're already too late. So you might as well go have some fun. Excuse me. Came back.
You're a happier person for that trip, are you not?
Oh yeah, it was a great, fulfilling trip, and I would have regretted not going. And came back and had a surgery, and I had a pretty aggressive tumor, is what I've been told. Actually spread to my trachea. Had a little trachea removed. 3 days in the ICU, a couple days on the floor. Went home with the C-collar for a month straight. Shower, bed, everything, had to wear it. But a lot of this, and we talked about just staying out of the fear. As a nurse, I know all the worst case scenarios. And it was really hard not to get, oh, I'm starting to feel like this. Oh, it could be this, it could be that, it could be that. And just really just kind of, take a deep breath and just kind of focus and see a positive outcome. I visualized a lot that, and she was like, you got to stay out of fear, you got to stay out of fear. And that really helped, because as soon as I started getting into it, I could really feel myself, my heart rate going up, and my energy started going down. And it's just amazing how just our thoughts will help us get better. And I ended up doing external radiation, 37 treatments. And I haven't told you this, but 2 weeks after my last treatment, I did a job interview and got hired on the spot. Had to wait till my collar kind of covered everything, and they just kind of thought I had the sexy, gravelly voice. They didn't know any different, and after they offered me the job, I was like, oh, great, I still have to tell them because I'm going to be doing RAI in the next week or so. And I'm going to be starting a new job without my Synthroid and everything. But Part of it is I want to plan for the future. I don't want to sit around and just dwell on and think I can't do anything. You know, because I'm like, you're crazy. You're still going through treatment, going for job interviews, and got an $8,000 raise. So I was pretty happy about it. But, you know, and the video that we're showing, I think part of it is like, you know, once you get labeled that cancer, and this is supposed to be the good cancer, you know, there is no good cancer. It's cancer and it sucks, but we can, the positive part, positive programming, I like to call it, helps tremendously. But that's what I got to say.
Anybody else have something to say that they're grateful for? I'm grateful for all of you.
Yeah.
Lauren?
So this isn't, I mean, I'm not going to tell you the whole backstory, but anyways, I ended up having 2 surgeries to have my whole thyroid out in June. Dr. Vanderveen was my surgeon, and I'm grateful for her. But I remember specifically when I was grappling with having to be reliant on thyroid hormone replacement for the rest of my life, which is kind of daunting if you've never, you know, been reliant on something for, you know, your life and your vitality. You know, that's kind of a scary thing. And I'm not a believer in the zombie apocalypse, but I remember I specifically asked Dr. Vanderveen, I said, Dr. Vanderveen, what am I going to do when there's a zombie apocalypse? You know, like what happens to all of us? And she looked at me and she didn't laugh and she said, you know what? I'm going to be right there with you. And there's millions of other people that are on, you know, thyroid hormone replacement, and we're all there together. And I think that that's what I'm grateful for, is to be able to, you know, be surrounded by all of you, but also to be reminded that there are so many of us, and that, like, the zombies better watch out, because I think there's more of us than there are of them. So thank you.